Hey guys! So my name is Autumn, and I'm actually going to be starting a new YouTube vlog channel in regards to my process of going through an anterior lumbar interbody fusion. So today, this will be the first uh, episode of the channel. So a little bit about myself is I'm 25 years old. I'm originally from Kansas City, Missouri, and I live in New York City permanently. Currently, I'm actually staying with my sister and my brother-in-law in Denver, Colorado. I'm basically starting this vlogging channel to go ahead and assist other people who may be experiencing chronic lumbar pain, and also answering any questions or just guiding you guys through my process and this journey of having this procedure that's going to be taking place probably 2 weeks from today. So, again, I'm 25 years old, and I've been experiencing lumbar chronic back pain for over a year now. It first started with pain in my knees and swelling and mild back pain, lower back pain. So, my doctor in New York, who's associated with NYU Langone, went ahead and had me do an EMG test. After that, we did an MRI and we found out that I have what's called mild degenerative disc disease and stenosis. Not too crazy, not too you know, where it needs to be treated right away. So that was relief. Our next plan that we went ahead and did is we did a back brace. We had physical therapy. I also spent $400 on orthotic inserts for my shoes because, again, I spent a lot of time on my feet. As you can imagine, it's New York City. You walk everywhere. I'm also a bartender and a server, so again, I'm on my feet a lot. After the MRI, we went ahead and did all those treatments, as well as I've been on medication for over a year. I've also been receiving cortisone shots back to back, and just recently, about 2 months ago, I received my last cortisone shot and found out that there was what's called L5 pars fractures in my spine. It was a little crazy that these were detected at this time because they did show on the MRI about a year prior to that. So my doctor went ahead and ordered another MRI and a CAT scan just to follow up and see exactly what was causing me so much pain. Again, we found out that I had what's called L5 pars fractures. So that was the reason why I was having issues with standing for long periods of time or walking really long distances. After we found that out, he then referred me to go ahead and see a spine surgeon because at that point we had already exhausted all other treatment options. As you can see, pain management, we try to do things in baby steps. So, at that point, I decided to come to Denver, Colorado to stay with my sister and to find a surgeon out here who actually works at the same hospital as her, so that was kind of comforting at that level. I did find a surgeon, and we went ahead and spoke with him, and he ordered another x-ray, and he looked at my MRI that I did recently in my CAT scan, and he was just astonished because at this point, my spine has actually gone to what's called spondylolisthesis. I believe that's how you pronounce it. So the disc is actually slightly slipping forward, and there's levels grade 1, 2, 3, and 4. I seem like I'm knowledgeable about all this only just because I've done my homework and because I want to know exactly what's going on with my body. He was really, really surprised because he had seen that from the MRI from a year ago showed those defects, and it could have been treated a lot earlier. So now that my pain has actually progressed, it's no fun at all. I'm 25 years old and I can't stand it. I can't even be active anymore. And it's as some of you may know, that chronic pain can give you depression. And somebody like me, who's usually happy and outgoing and just free-spirited, I just started feeling really down. And so my doctor ended up putting me on Cymbalta to treat my depression and chronic pain. which is no fun. So the new surgeon that I saw here in Denver, Colorado, he referred me to do a facet injection. Usually a facet injection has a cortisone and a Marcaine, which is a numbing agent. That's actually for more internal use. Because I had done my cortisone injection 2 months ago, he didn't feel comfortable doing another one back to back, so we just did the Marcaine injection. There was a little bit of complications because the radiologist ended up taking a little bit longer to inject my right side where my fracture was. He was having some issues with positioning the needle and not really pinpointing from the imaging machine where to inject. After the injection, I felt immediate relief. I had no more pain in my left leg, no more sciatica. I mean, I can literally, like, I can move around. I cried. I was pain-free. I then started experiencing a headache. So we went right back to the interventional radiology department and they had me lay down, and it was only occurring when I would sit up that my head was just like pounding, and I had to like squint my eyes because like even sitting up was just like profuse pain in the back of my head, and it hurt really bad. The radiologist had told me that it was very, very unlikely that he injected my dura, which is in the spinal canal, where it can cause leaking from your spinal fluid. So I took his word. I left the hospital. 2 visits later to the emergency room, I finally got my blood patch, where they did an epidural and a blood patch. And I kid you not, I was throwing up. I could not sit up. My pain with my head was so profuse. I would tell you right now, I would rather experience my back pain than the chronic headaches that I was getting from the spinal fluid that was leaking out. So after the blood patch, I was good. Today, I went ahead and saw my doctor, and because he said, you know, we know what the issue is, after the injection, you felt immediate relief, I want to go ahead and do what's called an anterior lumbar interbody fusion. I've done my research, and I've done my homework, and I'm pretty confident that with me being young and semi-petite, my healing process will be pretty quick. The recovery time won't be as invasive. But again, that's why I'm doing this vlogging channel, just to kind of give you guys updates, you know, pre-op, post-op, during the process of me being in the hospital, what it's like to have this procedure done. So the doctor's going to go ahead and do the fusion from the front side, the anterior part of my body, through my abdomen. And to stabilize those fractures in the back, he's then going to go through my posterior side, and he's going to flip me and put in screws in there to stabilize the fusion from the front, screws from the front and screws from the back. I'm a little scared, but I'm just ready for this to be treated. That's it. So I'm sure a lot of you out there can relate to me, you know, the pain that you're going through. And if there's any questions or any concerns, or you guys want to give me a thumbs up for the video, for my first video, because, you know, I'm not really a YouTuber, or, you know, like it, have any comments or questions, let me know. So yeah, I'm just going to keep you guys posted through my journey of doing this procedure, and, you know, and let you know. That's it. All right, bye guys.